Hey there, we're having a different conversation today, one about men's health. If your man has been more tired than usual, moody, low on energy, or just not himself lately, you're not imagining it. There could be something deeper going on. Today, I'm joined by Dr. Joshua Gonzalez, a board certified urologist and sexual medicine specialist based in LA, who helps men and women get to the root of hormone imbalances and sexual dysfunction without all the shame or fluff. He brings a modern, inclusive, no BS approach to men's health. And if you follow him on Instagram, you already know he's super smart, funny, and tells it like it is. Thank you so much for being here. I'm really thrilled to have this conversation with you.
Yeah, thank you for having me. I appreciate it.
Yeah. So while I mostly support women over 40, many of them
hmm
do have male partners or just other men in their life who are noticing a midlife shift for them too.
hmm
And even though, we hear a lot of things out there, like it's so easy for men to get testosterone, but so hard for women to get on HRT. I don't
hmm
think that nearly enough men are on it or getting the support that they need. So do you agree with
Yeah.
that?
Yeah, completely. I mean, I think, yes, there's certainly an imbalance, and I would agree with the statement that it is generally harder for women to find access to appropriate hormone therapies than it is for men. However, men are also generally worse at taking care of themselves and or seeking help or answers for issues they may be dealing with. So I think women generally take better care of themselves. They're used to seeing a gynecologist from like a very young age. Whereas men are often not really interacting with the healthcare system, past maybe adolescence when they're getting like school physicals. But then, unless you have someone who's super proactive about their health, they're really not encountering, a primary care provider until their mid to late 30s or later. Um, and so often go years undiagnosed with things like low testosterone.
Yeah. On your website, and your website's really great, you have a free ebook there. And I was reading
hmm
through it, and you have some pretty crazy stats. So one in
hmm
five men over 30 have low testosterone, and 90% of men with low testosterone never seek treatment. I mean, I
hmm
think it's because of some of the things you just said, but also lack of education. And when it comes to testosterone specifically, I feel like there's a
hmm
negative connotation around it. Would you agree?
Yeah, I mean, I think a lot of that is based in misinformation. It's a similar kind of narrative or story that happens with women's hormone replacement therapy, menopause hormone therapy, um, in terms of a couple of bad studies that got a lot of media attention have shifted the narrative in the general population, and that has influenced how doctors perceive hormone therapy and how they counsel patients on it. So, a lot of your listeners are probably familiar with the Women's Health Initiative and like the damage it's done for the last 20 plus years in women's access to hormone therapy. But there were a few studies, I think like two or three studies published probably now 10 years ago, 10 plus years ago, um, that showed or reported to show a link between adverse events and men who are on testosterone replacement therapy.
Mhm.
Um, those studies have essentially been debunked now. There was like calls for retraction by a lot of academic programs and societies basically saying this data as you're presenting it is invalid and poor and the statistics were poorly done and it invalidates your findings. And really those three studies went in the face of or were in contradictory to decades of data that we had on the safety of testosterone replacement therapy in men. So there was a large prospective randomized controlled trial published just within the last 2 years, called the Traverse trial, that hopefully has put a lot of those fears to bed. But it essentially looked at cardiovascular events in men who were on testosterone replacement therapy compared to those that were not. And they specifically studied men who were at high risk for cardiovascular events and found no difference between those two groups. So,
Wow.
even in the worst kind of patient, the like highest risk patient, there was no difference in cardiovascular events in men who were on testosterone replacement compared to those who were not. And we know from other data, looking at prostate cancer and some of the treatments that we put men on to block testosterone, that men with very, very low or castrate levels of testosterone therapy are at increased risk for cardiovascular events. So, I think a lot of the fear about hormone therapy is unfortunately based on a lot of misinformation that continually gets sort of put out there in the media and people talking about it online, just not fully understanding what the data actually show.
Yeah, that's wild to me. It just
Mhm.
really is. But I guess I'm not surprised because of, like you said, the
Yeah.
damage that the WHI did for 20 something years. I mean, so many
Hmm.
millions of women were impacted by that. And we're trying to undo the damage, but it feels very slow.
I think that there is sometimes a resistance on the part of the providers
Mm.
to talk about the benefits of testosterone therapy, because it gets lumped into this like sex thing
Yeah.
too often, right? And this is true for women as well. But um, when someone has hypothyroidism, their thyroid is not producing enough thyroid hormone anymore, no one ever questions at all or bats an eye at like putting someone on thyroid hormone, right?
Mm.
And for some reason, we treat sex steroid hormones differently because they're made in the testicles and made in the ovary and get lumped into this sort of like sex category, that there's an underappreciation for the importance of what these hormones do to the body in general, right? So men who have lower testosterone levels report things like brain fog, difficulty keeping on muscle. And we're not talking about like bodybuilding muscle, but like literally maintaining muscle strength, which is increasingly important as we get older. It's important for cardiovascular health, as I mentioned, um, cognitive function, energy levels, right? Like, so your men often walk around feeling fatigued all the time or feeling like mild depressive symptoms. So
Mhm.
it does a lot of important things beyond just making people have better erections or making them hornier. It's really important for quality of life also. And I think a lot of providers don't take that into account when they're talking to their patients about the potential benefits of testosterone replacement therapy. And they often frame it in the context of like, well, you're getting older. This is the natural part about getting older. And you don't really need to be on this stuff. And
Mhm.
while some of that is true, it is more common as men get older for their testosterone to be lower. It doesn't mean that there are not plenty of benefits and very little risk associated with these treatments.
Yeah, I agree. It seems like if somebody has erectile dysfunction or low libido, that's when somebody may be offered testosterone. But you
Yeah.
listed just a few of many symptoms associated with
Hmm.
low testosterone. And I'm going to try to give him some privacy, but my own partner, he's in his 40s, and we noticed, gosh, in his late 30s that he had a lot of
Hmm.
different symptoms. And of course, knowing what I know, I was like, you got to go on testosterone, got to go on testosterone. But, when he was
Yeah.
ready, he finally, started to seek, support for that. But it wasn't as easy as I thought it would be for him
Yeah.
to get on it. And one doctor in particular, tested his cholesterol levels, and he saw that his total cholesterol was a little bit elevated, and he wouldn't
Hmm.
give him testosterone. I was
Hmm.
like, what? Like,
Yeah.
so,
Well, the irony of that is that people's lipid parameters often improve when they're on testosterone or
yeah.
or have healthier testosterone levels, right? So like that actually is an argument for maybe putting someone on
Yeah.
treatment. And then I think a lot of men in his age group that we consider, younger men
Mhm.
are dismissed, right? Like if you come in complaining of some of the symptoms, feeling tired, brain fog, it gets attributed to these other things, life stressors, or you're just depressed, or you're unhappy in your relationship if they're having problems sexually, those sorts of things. Similar things happen when women seek help for these sorts of things as well. But younger people, I find, get dismissed more than some older people because they feel like, oh, you're too young to have a hormone problem, which is not true. Like we know that testosterone declines linearly with age, starting around age 35. So, he's in that window where one should suspect that testosterone could be a problem if he's complaining of symptoms that we know are associated with low T.
Yeah, I mean, he's 44 now, and he actually just got started on TRT. And I
Hmm.
was like, thank the Lord. Because, I mean, I just know that things could be optimized for him all
Hmm.
around. And he
Yeah.
ended up going to a urologist because that was the only person who would prescribe. And
Yeah.
knowing that he had, elevated lipids, and I say in quotes because, I mean, we know that's not always
Right.
problematic, and, the range
Right.
that they're using. Um, but okay, so moving along, I want to kind of go back to some of these symptoms because I want
Hmm.
my listeners to understand and recognize some of these in their partners or sons or friends or whoever, whatever male, is in their life that they're concerned about.
Yeah.
So can you kind of review them again, the obvious ones and maybe not so obvious
Yeah.
symptoms?
Yeah, so I would say the big ones are fatigue. So people will often complain of feeling a bit like a big crash, mid to late afternoon, where they just like feel like they always want to take a nap, right? They just have no energy to kind of do the just sort of daily activities. Um, a decrease in sexual desire, which I always tell patients fluctuations in libido. Um, are common. There are certainly other reasons that you could have low sexual desire, but that is something that often will bring people to the doctor, asking to be tested for testosterone. Um, Erectile dysfunction, that's an obvious one, right? If somebody's having problem achieving or maintaining an erection, that usually is something they notice. Um, but other changes can be very subtle, right? So like a loss of muscle mass or a difficulty building muscle despite resistance training and exercising regularly. I see a lot of guys who are like, I like am doing the same workout I did 5 years ago, and I used to like be able to like see muscle mass or keep my body lean, and now I'm like gaining fat. No matter what I try to do, I'm eating healthy. I'm doing all the things I used to do. It's just not working anymore. So a change in body composition that favors more fat storage as opposed to like muscle building.
Mhm.
um Mood changes, right? There are obviously lots of reasons some men can have depression or anxiety, but seeing that in patients who've never really struggled with those issues, who have no other extenuating circumstances that could explain that, who start feeling depressed, they'll say things like, I don't feel like myself anymore, or I'm anxious for no reason. Those can sometimes be symptoms of low testosterone. And then some cognitive stuff, right? Which also can be very, very subtle, where people just kind of report this fogginess that they never used to have, or have problems with memory recall or concentrating in ways that they previously didn't have a problem. Now they have trouble, paying attention or concentrating. So those I would say are like kind of the big ones that we see.
Okay. And in terms of testing, what are you typically suggesting people do? Total testosterone, free testosterone,
Mhm.
anything else that you would throw in there?
Yeah, so we do kind of a comprehensive panel, just because we want to make sure we're not missing anything. So when patients come in, like as a new consultation who have symptoms of low T, we're checking total testosterone. We check something called sex hormone binding globulin, which is a protein that binds testosterone in the blood, and use those two measurements to calculate the free testosterone. I don't love using the lab calculated free testosterone because it can be pretty variable, but there is an online free testosterone calculator that you can use and plug in total testosterone, SHBG, and your albumin, and it'll give you a calculated free T. So we look at that. We look at dihydrotestosterone, which is sort of the end product in the testosterone pathway, because that is essentially what mediates all of the effects of testosterone. We look at estrogen levels because if we're going to put someone on testosterone, that can affect their estrogen levels. So we want to get a baseline there. We look at their pituitary hormones, LH and FSH, which regulate the testicle, and see, what's going on in that system. Where is the disconnect between the brain and the testicles in terms of testosterone production? We look at other pituitary hormones like prolactin, thyroid hormone, just to make sure that there's no problems there. Sometimes prolactin issues can cause low testosterone, so you want to make sure that you're not missing that as well. And then, depending on the person's age, we like to get a baseline PSA on our patients as well, which is a prostate cancer screening test. So those are the big ones, I would say.
That's pretty comprehensive. And I would venture
Mhm.
to say that most men are not getting those labs if they're going to with
No,
their PCP.
that's right. Yeah, I would say baseline. If your listeners and your audience are not going to someone who's checking a comprehensive panel like that, total testosterone, SHBG, or if they can get if they can get a free testosterone check, those are really important. LH and FSH, at least as a baseline, are important because you need to know what's going on between the brain and the testicles,
Mhm.
and then prolactin.
Okay. I love that.
Yeah.
Hey, if you're resonating with this podcast and realize that your symptoms are anything but normal, my comprehensive program, the Perimenopause Method, may be a great fit for you. My team and I help women in their mid 30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and much more. We do this by utilizing advanced testing, a personalized plan tailored to you, women's health and hormones education, and ongoing support so you never feel alone and you get results. If you're ready to commit to your health and feel like yourself again, but even better, check out the link in the show notes to learn more about the perimenopause method. So, why do you think men, besides the natural decline that starts to happen
Mhm,
in our 30s, same for women? I mean, we typically start losing progesterone around 35 and above.
mhm.
Why do you feel that men's testosterone levels are plummeting as much as they are? Because it seems like it's even younger men.
Yeah, I mean, it's a global problem, right? So there's data that have looked at parameters of just men's health, men's sexual health, reproductive health. Globally, we're seeing declines in testosterone. We're seeing declines in semen parameters like sperm count and motility, and that's happening around the world. So there's probably is some sort of environmental factor. There's things that have looked at microplastics recently, some other sort of harsh chemicals that we're, interacting with on a daily basis. All of those things are probably affecting our testosterone levels. So that's certainly playing a role. I think there also is more awareness now, right? So there's more conversations happening about these things, and people are also now have the tools to be more proactive, right? They don't have to, gone are the days of them relying on a referral from their primary care provider to a specialist to kind of deal with these issues. A lot of patients are taking matters into their own hands. They're going online, they're on Reddit forums, they are, on Yelp and Google looking at people's reviews and finding providers that they feel would be a good fit for them to at least start those conversations. So I think all of that is kind of playing into why we're seeing people come in earlier with lower levels of testosterone than we were maybe, 40, 50 years ago.
Yeah, that makes sense. When it comes to sex and just libido in general, because I know this is a topic, we talk a lot about women who have low libido, but I don't think enough
Mhm.
people talk about men having low libido.
Mhm.
Obviously low testosterone plays a role, but do you feel there are other factors that contribute to that?
Oh, certainly. Yeah. I mean, I think libido for any person is a complicated matter. Um, the hormonal portion of that is often like the easiest thing for us to fix, right? If you see a guy with low libido, he comes in, his testosterone is low, we put him on testosterone. In a lot of cases, his libido will go up.
Mhm.
But in men, it can be a complicated matter as it can with women. So if it can be related to stress. It can be related to interpersonal relationship issues, right? If you're not happy in your relationship, you're probably not going to want to have sex with that person.
Mhm.
Um, if you're super stressed out at work or for other things going on, like we saw it a lot in the pandemic. We in LA, we just went through like a terrible fire season, right? So like people were displaced, and I was seeing patients who had been stable for years coming back and saying like, I have no sexual desire, and
Yeah.
we hadn't really changed anything about their care, and I just had to have a conversation with them about like, you're going through a lot right now. You're like had to leave your home, you lost your home, like all of these things can affect how you feel sexually.
Mhm.
So I think it's always important to kind of assess those aspects also. Mental health is an important thing, right? Like screening people for depression, and also taking into account if they have a history of mental health difficulties, what medicines are they on for those treatments? Because the medications themselves can often cause sexual dysfunction, including low sexual desire. So all of those things we sort of want to take a look at when we're evaluating someone with low libido.
Okay. Yeah, it certainly seems to be multifaceted.
Hmm. Yeah.
So when it comes to testosterone replacement therapy, who should consider it? And is there anybody or any group that shouldn't be considering it?
Um, who should consider it? I would say if for it, the first step is just getting a diagnosis, right? So like if you suspect you may have low testosterone, finding a provider who's willing to do the testing and seeing where you fall is important. I think it's also important for your audience to understand that I often will put people on hormone therapy, testosterone replacement therapy, even if they're quote unquote in the normal range, because there's a lot of men who fall into a low normal value, right,
Mhm.
who have all the symptoms that we associate with low T, who do better when their testosterone is higher. So those strict cutoffs um, are sometimes important for whether or not the treatment is covered by their insurance. Um, but those are not necessarily um, the end all be all of whether or not I'm going to treat a person. So I would say if someone has symptoms and they have suboptimal testosterone levels, low normal or below the normal range, then there's not really anybody that I wouldn't consider putting on treatment. Now, there's a couple things to keep in mind, right? If you're a younger man, there are some consequences that come with testosterone replacement therapy that I think are important to review. And I see a lot of younger men put on testosterone outside of my office who come to me not understanding that these are risks associated with TRT. And the main ones are that it can sometimes cause testicular atrophy, so your testicles can decrease in size a little bit. That tends to be something that bothers younger men more than it does older men. Um, that atrophy is happening because you are suppressing your natural testicular function. And so your natural production of testosterone goes very close to zero, and your sperm production also goes down quite a bit. So it can cause problems with fertility. In those cases, there are other treatments that we can put people on to stimulate their body to make more testosterone. Um, but I wouldn't say that that would be something that would disqualify them from treatment. And we have younger patients who know those risks and still opt to do testosterone replacement therapy. So it
Yeah.
doesn't mean that they can't. They should just be allowed to make an informed decision in that regard. Um, but there's data that have come out showing that you can safely put someone with prostate cancer who's been appropriately treated on testosterone replacement therapy, if they have evidence of low T and are symptomatic. Um, and that would be a quote unquote high risk patient. I already mentioned the Traverse trial, which looked at quote unquote high risk cardiovascular patients, and those patients can be safely put on testosterone replacement therapy. So there's not a lot of exclusion criteria in my mind as to who would be or would not be a good candidate for TRT. Now, I always want patients to make an informed decision. I never want to contradict what another provider might say about this. So, if I have someone who's had a heart attack and a couple of stents placed, and they have a cardiologist, and I think they would benefit from being on testosterone replacement therapy, I always just tell them, here's what I'm recommending. Talk to your cardiologist about it, get their input, see what they think. And a lot of times, they come back to me saying the cardiologist was fine with it, like let's proceed with treatment. There's been a couple instances in which I hear from patients that they were talked out of or told something incorrect about what their real
Mhm.
risk is with these treatments. And in those cases, I treat it on a case by case basis, but I just have another conversation with them, and I'm like, here is the actual data. Here is your real risk. And I think that in this case, the benefit outweighs the risk.
Yeah, that's great. I think that's all we can hope for is some informed consent and looking at
Yeah.
the up-to-date
Hmm.
research.
Yeah.
So thank you for that, being a provider who does that, because
Hmm.
unfortunately not many do.
Yeah. Yeah.
Yeah. So can we talk a little bit about supplements? Because there's a lot
Hmm.
out there, of course, marketed to women, but also to men, like to get their
Hmm.
testosterone up, to improve their libido. So do you feel like there are some that can help? Because I think you have a supplement line, correct?
I do, yeah. So we launched Popstar back in 2020 with an it's a volume and taste enhancer supplement. It was mostly because we were seeing patients complain of decreased ejaculatory volume,
Mhm.
and a lot of them saying that it was, it was causing a detrimental effect on their sex life. They felt like their orgasms were less intense, sex was less pleasurable because of this decrease in volume. And so there are medications that we can put people on to increase volume, and a lot of that is typically done for reproductive health.
Mhm.
But there was not any kind of like doctor formulated, like well researched um, supplement out there for this particular issue. So my business partner and I kind of put our heads together, looked at the available data, which are fairly limited, as you can imagine. There's not a lot of data on ejaculatory volume as it relates to pleasure. But we looked at the reproductive literature, we looked at veterinary literature, whatever we could find in terms of like ingredients that could potentially increase volume. We did that research. And spent a lot of time putting together the formula and have had very good results with it. So that's kind of where Popstar initially started. Um, we have now a couple additional products. We have a fertility specific supplement because many of the patients who started on the volume and taste enhancer would ask us like, hey, we're trying to get pregnant. Will this help? And while there are ingredients in that initial formulation that will help fertility because of the effects on volume, we wanted to create a separate fertility facing supplement. So we have one that has a different set of ingredients that are primarily focused on improving sperm health.
Mhm.
And then we have like a delay spray for men with premature ejaculation. So we don't have a testosterone supplement yet,
Mhm.
but have talked about that. Um, the data are not great, to be honest, about specific ingredients that can improve testosterone. Zinc is one that has sort of been tried and tested. So that is definitely something that someone could look at in terms of testosterone health. But I did a presentation, God, back in 2017 or 2018 at the Sexual Medicine Society of North America, and the data on supplements in general is not super robust. So the data are limited specifically on ingredients that positively affect men's sexual health. I would say zinc, ashwagandha has been looked at. There's one called Tonkat Ali.
Mhm.
Um, and so a lot of these you can find, at like your uh, local GNC or supplement store. And what I tell patients is it's likely that it won't hurt anything. And, if you take these supplements in conjunction with other important lifestyle modifications, maybe you'll see an increase. Um, but let's keep an eye on it, and if things are not improving with this sort of supplement route, then we should really consider putting you on some sort of hormonal therapy. um, and sometimes we see patients come back and they really commit to the lifestyle modifications, and then it becomes a little bit difficult to figure out, like, is it the supplement or is it because they're doing what I told them
Yeah.
to in terms of like getting 7 to 8 hours of sleep and exercising the minimum 3 days a week with resistance training,
Mhm.
eating a healthy diet, like they're doing all those things and taking the supplement. It's like hard to parse out whether the lifestyle stuff or the
Yeah.
supplement are actually helping. So some people come back and they are feeling better and their numbers look better, and great, we can avoid putting them on treatment.
Mhm.
But not everybody. Sometimes
Yeah.
people do really put in an effort to do things quote unquote more naturally,
Mhm.
and it just doesn't work. And I try to explain to them, like, this is a function of time in many cases, right? Like
Mhm.
if you are somebody who's in their late 30s, early 40s, or older, like your body is not equipped to continue to pump out healthy levels of this hormone. And so it's
Mhm.
okay to like need medical intervention in some cases.
Yeah, I agree. And thank you for saying that because I think especially in the online space and the like holistic
Mhm.
world, and I'm a holistic health coach. I mean, I'm very well aware
Mhm.
of that, but I'm over here like hormone replacement therapy, and people probably are like, I don't understand. That's not
Right.
natural. And I'm like, yeah,
Right.
but we can't ignore basic physiology. And this is
Yeah.
not news. Like as we get older, our hormones start to decline, and there's
Yep.
nothing wrong with getting some help. I know I started HRT, gosh, a few years ago, and honestly, it was life-changing for me. I was feeling
Yeah.
pretty lousy. And I
Yeah.
did all the
I
things,
mean,
right? I did the lifestyle changes. I ate healthy, all
yeah.
that. So,
Yeah, and I think I think it can be a point of motivation, right? If someone is coming to see you for hypogonadism and symptoms of low T, um, that is a point where we can intervene and be like, okay, well, maybe you haven't been making the best choices in your life from a hormone health perspective, but these things that I'm going to talk to you about doing are also going to be important for your overall health
mhm,
and should be something that if we're going to put you on treatment that you do concurrently, because
yeah.
testosterone isn't a magic treatment for everybody, right? Like you can't just like inject yourself with testosterone or put on a testosterone gel or take a oral testosterone capsule and sit around and eat whatever you want and not exercise and not take care of your body. Like not going to have the effects that you want it to have unless it's done as part of a sort of full spectrum wellness plan that you're doing all of these other things concurrently.
Yeah, I agree. I'm constantly beating that drum here about
Yeah.
dietary changes, lifestyle changes, for
Yeah.
women too.
Yeah, and I think I it's frustrating, I think, because again, going back to this thyroid example, or insulin resistance, or the development of diabetes, right? Like those are also hormone problems.
Mhm.
But we never like dismiss patients when they have hypothyroidism, like as not being worthy of being on thyroid hormone. Like we will
Yeah.
just put them on thyroid hormone.
Mhm.
But for some reason, these sex steroid hormones just get treated differently, and there's some sort of there's shame around it. There's like judgment around it from the physician standpoint,
Mhm.
as to like who should be on or who's worthy of being on these treatments.
Yeah. Well, hopefully we're changing that conversation.
That's the goal. Yeah.
Yeah, yeah. If somebody wanted to start ERT, you mentioned injections, pill, gels. Like, is there anything that
Mhm.
you tend to prescribe more, or is it just a case by case basis, preference, accessibility, and so on?
Yeah, I mean, I think a couple things go into it. It is a person's age, right? So, and whether or not they want to preserve their fertility, that kind of is the first fork in the road, right? So, if they don't care about preserving fertility, testosterone replacement therapy is something that we'll probably consider as a first line therapy. If they do, there's medicines like clomiphene or HCG, which we can put them on to stimulate natural production
Mhm.
of that hormone. Those become increasingly less successful the older a person gets. But for younger guys who want to make sure that they're still producing sperm, that's typically the route that we'll go. And then when choosing different TRT formulations, it's dependent on what a person is willing to do, what I think that they will actually be compliant with, what their insurance will cover. So that those are kinds of things that come into play. And I talk to patients about all of them. So the gels have to be applied every single day. Um, when applying them, you do need to be careful for about 3 or 4 hours afterward that you don't shower, bathe, sweat from working out, or do anything that's going to wash them off prematurely. You also need to be
Mhm.
careful that they don't transfer to another person.
Yeah.
Um, but with some education and attention to detail, that's not usually too big of an issue, and some patients like that because it's easy to put a gel on your skin.
Yeah.
um, the injection is done once a week, very easy to do. We teach patients how to do it all the time in the office. So even for someone who's not thrilled about the idea of a needle, most 90% of those patients will do fine once we educate them on what the injection involves and do the first injection here in the office.
Mhm.
If I have someone who's absolutely needle phobic, cannot even look at a needle, then we can talk to them about oral testosterone options. And I think the oral testosterone options have a lot of benefit to using versus the gels and the injections, in that it's easy to take a pill, but they have to be dosed twice daily. So you have to have someone who's very compliant. Men sometimes are not the best at following instructions when it comes to to medications.
Yes.
But if they're super motivated, it provides kind of a more physiological way to get testosterone, because we typically will have them dose it in the morning and then kind of early afternoon, so they're getting peaks of testosterone um, when you need them the most, and it's mostly out of your system by the evening, so the body can kind of reset, and you're not consistently suppressing your testicular function, so less atrophy, less effect on sperm production, and less elevations in hematocrit, which is one of the things that we have
Mhm.
to monitor when someone's on TRT.
Okay.
There are pellets that we can implant under the skin.
Mhm.
So people who want to set it and forget it and not think about it, we can insert pellets under the skin, typically kind of at the upper part of the butt cheek. And those last for usually 3 months. And
Mhm.
so it's like a small office procedure done with local anesthetic. We put the pellets in, and they're good. They come in 4 times a year, and a lot of guys like that for the convenience. So those are kind of the primary ones that I discuss with patients, and we just make a decision together as to like what they're willing to do, what we think might be covered by their insurance, or what might make the most sense for their lifestyle.
I love that. And I love that you offer all the different ones because, there's a
Mhm.
lot of people that kind of get on their soapbox about certain types of HRT and what they would
Mhm.
use and what they wouldn't. And I say this over and over to my clients and my audience, like we are all unique. And what
Mhm.
works for one
Yeah,
person may not work for somebody else. And we have to consider budget, preference, all the things. So thank you.
absolutely. Yeah, yeah. I think it's super, super important. And also I think patients are going to appreciate that sort of bespoke, tailor-made like plan for them, right? Like if I go into the room and say like your testosterone's low, you're going to be on injections, they might be like, well, are there other, they're not going to appreciate it as much as if you have a conversation about all the options and say what makes the most sense for you, because I want you to start this and I want you to be compliant with this so that you can feel your best, right? You don't want to choose something that they're like, if for instance you have somebody who's super busy who's like, I'm not going to remember to take a pill a second time a day, then the pill's not going to be a good option for them, and we'll just cross that off our list.
Yeah. Um, yeah, I love that. My man didn't want to do the big needles. So
Hmm.
so his urologist offered him, and of course the name is escaping me. It starts with an X. It's like a kind of looks like
Oh,
an EpiPen.
Zyosted.
Yeah.
Zyosted, yeah.
What
Yeah,
do you
so
think
it's
of
a
that?
it's great. Yeah, yeah. I lumped that in together with the injections. I,
Okay.
I forgot to distinguish. Yes, so there are intramuscular
Okay.
injections, there are subcutaneous injections. Both of those can be self-administered where you draw the medicine out of a vial.
Mhm.
Um, and then there is a commercially available subcutaneous auto-injector pen, and that's Zyosted.
Yeah.
That works great. There is some insurance coverage issue sometimes. They don't always cover it as like a first line therapy. But yeah, we prescribe that a lot. A lot of our patients like that.
Yeah. I actually did it for him. He was like trying to do it. And he's like, it's not going in. And I'm like, let me do it. So I felt like I was stabbing
So
him. But
funny.
anyway,
Yeah.
I was just like, whatever. He's like, I was not going to do the needles. So this is much
Y-
more manageable.
Yes. Yeah. And you don't see the needle, like you push a button, count to 10, and like you
Yeah.
barely even feel the injections. It works very nicely.
Yeah. I mean, we'll see. Like I said, he just started. So I know it's trial and error with a lot of this,
Yeah.
but it
Yeah.
was great that his urologist even offered it.
Yeah.
So
Yeah.
anyway, thank you so much for your time. I have one more question for you, then I'm going to let you
Yeah.
go. Obviously, a lot of people are listening to this podcast and they're going to share it, I'm sure, with their male partners, friends, and whatnot. But in terms of
Mhm.
sex, so, a lot
Mhm.
of people say that sex kind of goes out the window in their 40s and above, and they want to make sure that they have a good sex life, especially if they love their partner. So,
Mhm.
can you finish the sentence? If you want to have great sex in your 40s and beyond as a couple, you need to.
Be proactive. So I think that you're correct. I think people tell themselves and or have been told by a healthcare provider that they've reached a certain age, sex really shouldn't be a priority. We know that from real world examples, your clients, my patients, a lot of people are motivated to continue to have that aspect of their life. It's a really important part of our quality of life. And
Mhm.
so I think if you are someone who prioritizes that and wants that to continue, then seek out help. And it may mean that you have to go outside of your normal, you know, provider, right? Like if it doesn't seem like a priority for them, then maybe find someone else who will be willing to listen to you and talk to you and provide solutions for whatever issues are causing you to not be able to continue to have the best sex that you want. So I think being proactive and seeking out providers that are willing to work with you to continue have that be an important part of your life is crucial.
Yeah, thank you. And you're
Mhm.
one of those providers. So do you offer telehealth or do you only see people in person?
No, we do telehealth as well. Typically, I mean, depending on the individual, sometimes there is a need to do an exam if there's but can often arrange that if someone, if in the initial consultation I say like, you know what, I think we need to do an exam before we moving forward with treatment, we will let them know that. But in many cases, we can at least get started with a virtual consultation.
Awesome. And where can our listeners find you?
Yeah, so I'm on most social media platforms at Joshua Gonzalez MD. My website, joshuagonzalezmd.com, is full of information regarding the services that we provide here. As you mentioned, there's the elitist testosterone handbook that men can read about. The numbers behind low T and understand that they're not alone in dealing with this problem. There's a blog that we update semi-regularly with various sexual health topics as they relate to people of all genders. So, those are the best ways I think to get a hold of us. And then on the website, there's a tab to request an appointment, so that you can, hopefully get your questions answered.
Awesome. Love it. We will link to all that in the show notes. Thank you so much for your time today and all the
Yeah.
work that you do to support men and women.
Thank you. Thanks for having me.
The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.